This is KSL Sunday Edition with Deanie Wimmer.
This week on Sunday Edition, making pickleball more eco-friendly. Hear how a Weber State student is using the game to give plastic a second shot at life. Plus,
this is one of the oldest internship programs in the country. Wherever you go, you're going to find someone that got their start at the Hinckley Institute.
A major milestone for the Hinckley Institute of Politics. I'll look at the thousands of leaders they've helped prepare over the last 60 years. But first,
you're going to have more results, faster results, and actually more accurate results.
A new medical training facility on the campus of the University of Utah. How it will help address a critical shortage while getting you better health care. Welcome to Sunday Edition. The state of healthcare in Utah just got better for patients and medical students. A new partnership will bring more jobs and address a growing need in our community. They're cheering what that ribbon cutting means to our healthcare system.
This directly impacts healthcare here in the state of Utah.
A new clinical lab training center where students test blood and other body fluids using state-of-the-art equipment. A partnership between ARUP and the University of Utah.
Let's be clear, there is a shortage of medical laboratory scientists, not just here in Utah, but throughout the entire nation.
And so this is an opportunity to find a way to train additional students by expanding and forming collaborations with partners in the local community, and particularly in clinical laboratories, to be able to train additional students.
This announcement has implications for patients too, because up to 70% of the decisions doctors make on our health come from the tests in these laboratories.
So if there is an infectious disease and we want to figure out, the clinician is not going to be able to treat that disease unless they know what is the pathogen or the organism that or agent that is causing that disease. So we're going to be training students in that. We're going to be training them in testing body fluids, looking for abnormal cells in body fluids, pericardial heart fluid, abdominal fluid, all sorts of body fluids. So let's say you need to receive blood for a medical procedure, or you want to donate blood, that kind of thing. We train students in the procedures and technical skills that are needed to do the testing to support that and support blood transfusions.
This clinical laboratory training center will give U of U students access to world-class training and double the number of students in the program. They also have immediate opportunities to work in their field.
For 4 years now, we've had 100% job placement of students who have wanted a job upon graduation, and most of them have received their offers before graduation, which is really exciting for students.
Equally exciting, it bridges the gap of a community problem in healthcare.
There's a critical shortage of these medical laboratory scientists nationwide, and this is something that we have to solve because we're all getting older. We know we're going to need more doctors and nurses as healthcare for our healthcare, and we're going to need more medical laboratory scientists. So we took the problem on by having the Advanced Practice Training Lab. We can train even more students to go out there and work in clinical labs throughout the nation. And so that means you're going to have more results, faster results, and actually more accurate results as a result of this training program.
ARUP and the University of Utah believe this could provide a national model that would allow other areas to build similar partnerships. Right now, Intermountain Health is hosting free Ladies' Night Out events in 10 hospitals in Utah to celebrate women's health. According to Intermountain Health, research shows that women make 80% of the healthcare decisions for their families. So the more informed women are, the healthier we and our loved ones can be. The Ladies' Night Out events hope to empower women with the knowledge, resources, and support to make health decisions, which ultimately impact health in our communities.
This helps share information across our community to resources they might not have access to all in one place. So it's a one-stop shop where they can get information on mammograms, oncology, pregnancies, so forth. So there's all kinds of things here that they can focus on.
Here are a list of the remaining Ladies' Night Out events. If you'd like to go to one, you can expect to meet and interact with women health providers and various specialties, including women and newborn care, behavioral health, mammography, nutrition, and pediatrics. You can also visit the Intermountain Health Ladies' Night Out events webpage to find out more information. October is Breast Cancer Awareness Month. According to the Utah Department of Health, breast cancer is the most commonly occurring cancer in the U.S. and the leading cause of female cancer-related deaths in Utah. Joining us now to talk about Breast Cancer Awareness Month is Holly Tullis, a breast imaging manager with the Huntsman Cancer Institute. Thank you for being here.
Thank you.
You know, we've seen for years there are breast cancer awareness efforts and events. After all of that, how come it's still important to have awareness months like this?
Absolutely. We talk about this a lot. However, women in Utah as a whole are severely behind the national average in terms of screening for breast cancer through mammography. So it's just an important conversation to keep going.
So it's important to note that if you don't get into the screening, you don't get the benefits of all there are to address and to treat at an early age.
Early detection,
I should say.
Yeah. Early detection is key to ensure that you are doing all that you can to eliminate the breast cancer and continue to live your life.
Why is it so important to get tested? What can you detect now with the recent technology, and what treatments are there?
Right now, the reason it's important to get tested is that we have breast cancer risk assessment information. We can pull data, we can pull information to kind of determine a woman's risk in terms of the likelihood of them developing a breast cancer. We also have so much technology, it's just evolved so much. And with 3D tomosynthesis imaging, we're able to see so much more into breast tissue, dense breast tissue, see things that people cannot feel. So it's really important if you catch it at that point because it can be critical in changing the treatment options.
It's so much better outcomes, like you were telling me.
Absolutely.
What are the recommendations now, the guidelines? They've changed in recent years.
They've changed, and there's also so much conflicting information out there. We follow the American College of Radiology. We follow the Society of Breast Imaging, and they recommend women age 40 and older to have annual screening mammograms. And so that's what we want. No matter your age, at age 40, come to us, come visit us.
For every year?
Every year.
Okay. What if breast cancer runs in your family? That changes things.
Yeah. If you are high risk, we definitely want you to come in, but we also want you to have a conversation with your doctor. There is so much more besides mammography. Breast imaging as a whole can include ultrasound and MRI, and so we want to be creating a way to help you be your best. To have the best treatment plan for you.
An outcome for life,
Yeah.
right?
Yeah.
As a professional at this, it's got to be discouraging to know that there's such good treatment outcomes early on, and when patients don't take advantage of it, that's got to be hard.
It is hard, but there's also lots of reasons to that. Maybe it's lack of insurance, lack of transportation to get there. Women as a whole tend to take care of so many other people before they take care of themselves. So it is hard, but also like an ongoing conversation to bring awareness. So we love October. Breast Cancer Awareness Month is great, but the conversation needs to be all year long.
Okay, so something to keep in mind. Anytime you need one, you encourage patients, obviously, to take advantage of that.
Absolutely.
All right, Holly, thank you for the awareness and the reminder. That's really what it is. A lot of us know it. It's just making the time and taking the effort to get there.
Yeah, absolutely.
Okay, thank you. We appreciate
Thank you.
that. Now, still to come on Sunday Edition, how you can help struggling Utah families pay off their school lunch debts. And the Hinckley Institute of Politics, celebrating 60 years, how they've taught and prepared the very leaders in our state.